Peak T, a demonstration of mutual and combinational entailment. Complex IU reversal by Monique Burnett, Kevin Erdner, Maria Yukon, and Jennifer Woods.
3 participants were selected from regions across the United States. These participants included Henry, a 12-year-old Caucasian male, Joan, a 9-year-old African-American female, Leonardo, an 8-year-old Mexican-American male. Henry had a diagnosis of autism spectrum disorder, and sessions for him took place in his normal classroom from 11:30 a.m. to 12:40 p.m. Joan was a typically developing homeschooled student, and sessions for her took place in her home from 8:30 p.m. to 9:30 p.m. Leonardo was a typically developing public school student. Sessions took place in his home from 12 p.m. to 5 p.m. For materials, we used Transformation Module 14B, the IU Reversal Program, from the Peak T workbook. This module was Relational Complexity Level 4, which focuses on complex transformations of relational frames. We chose 5 arbitrary stimulus relations, including names and symbols. We used paper and pencil for drawing these symbols, data sheets, and the participants' preferred reinforcers during breaks. Prior to baseline, stimulus relations were labeled and arbitrary stimuli were assigned to either the experimenter or participant to ensure consistency across experimenters for training data collection. Experimenters ran baseline trials for each stimulus relation for at least 3 trials. No consequences were presented for correct or incorrect responses during baseline trials. Experimenters tested the entire program, which includes A to B, B to C, and Y to Z testing. During training of A to B, B to C, and Y to Z test trials were presented for each relation and were taught separately. For A to B, experimenters presented this participant with the symbol and asked, "What is this called?" For B to C, experimenters trained the relationship between the symbol, its name, and who was represented by each symbol. For example, I am San and you are Val. Who is San? Who is Val? For the Y to Z transformation test, the experimenter provides the participant with paper and a pencil and presents the discriminant stimulus. If I were you and you were me, draw what I would look like. After this is presented, the experimenter presents the reverse of this discriminative stimulus. If I were you and you were me, what would you look like? Participants were provided with verbal praise after each correct response. Incorrect responses were corrected using least to most prompting similar to that in discrete trial training. Maintenance probes were conducted following the mastery of all stimulus relations. No consequences were provided for correct or incorrect responses during these probes. Mastery requirement was 3 consecutive trials of correct and independent responses. Results. All participants were able to demonstrate mutual entailment across all stimulus relations. 2 of the 3 participants were able to demonstrate combinatorial entailment across all stimulus relations. Results of the study suggest that it is possible to teach mutual and combinatorial entailment using arbitrary stimuli.
Some limitations we had during this study is that we conducted this study on 2 typically developed children and 1 on the autism spectrum disorder. So the typically developed children might have had the somewhat of an advantage of responding more quickly than the other individual that was that had the autism spectrum disorder. This might have just affected the rapidly response on 2 of the individuals. We also had just a brief period of time to conduct this this study. Therefore, that might have affected in some way or form our results. The lack of pre-assessment didn't allow us to know previously if these individuals had the ability to do this program or not, and this might also have affected our results. And then the non-exposure to previous peak curriculum also might have affected the response. Further studies. A larger sample could help with the generalization of this study and maybe get better results. We only had 3 participants in this study, so maybe a larger sample could help with this in further studies. And another idea of how to apply these peak curriculums are to, in further studies, are to direct these studies to typically developed individuals, such as children with anxiety and adults with addictions. Both of these individuals may benefit from the peak curriculum.
Here's the data for the training across all stimulus relations, including maintenance probes. These are the 5 arbitrary stimulus relations that we trained across the participants. Thank you very much for watching our presentation.
After Joanne and Leonardo were able to make the transformation of stimuli, we conducted a probe trial in which they were both successful in the transformation of a new stimuli.